Welcome to the lecture on the hip joint. Please review open versus closed chain hip movements. Know that open chain hip flexion is similar to closed chain anterior pelvic tilt. Open chain extension is similar to posterior pelvic tilt in the closed chain position. Open chain hip abduction is similar to closed chain elevation of the opposite side of the pelvis, or contralateral pelvic elevation. Open chain hip adduction is similar to closed chain depression of the opposite side of the pelvis, or contralateral pelvic depression. Open chain hip internal rotation is similar to closed chain rotation of the pelvis to the same side, or ipsilateral pelvic rotation. Open chain hip external rotation is similar to closed chain rotation of the pelvis to the opposite side, or contralateral pelvic rotation. Be aware that due to the angles of the femur, muscles do not always lie on the side of an axis that you would expect, making the muscle line of pull concept a bit harder to see. The hip joint is the articulation of the acetabulum of the pelvic girdle and the head of the femur. The acetabulum is a deep socket for which the head of the femur sits. This deep socket is lined by the acetabular labrum. This labrum is a ring of fibrocartilage which serves to deepen the socket. Because of the deep socket, the hip joint is more stable but less mobile compared to the shoulder. The hip joint has a very strong and thick joint capsule. There are also 3 strong ligaments that reinforce the joint capsule. These ligaments are considered the primary ligaments and are named the iliofemoral ligament, pubofemoral ligament, and ischiofemoral ligament. All 3 ligaments limit extension, making extension a very stable position. The joint capsule and ligaments are most lax in flexion and external rotation, making this the most unstable position and more likely for dislocation to occur when the hip is in flexion and external rotation. The iliofemoral ligament, also known as the Y ligament of Bigelow, is the strongest ligament in the body. It connects the anterior, inferior iliac spine of the ilium and the rim of the acetabulum to the femur at the intertrochanteric line. The iliofemoral ligament limits hip extension and external rotation. This ligament maintains hip extension in the standing position without muscular effort. The lecture to draw in the iliofemoral ligament that goes from the anterior inferior iliac spine and the rim of the acetabulum to the femur at the intertrochanteric line. How does your drawing compare? The pubofemoral ligament, like the iliofemoral ligament, is located on the anterior aspect of the hip joint. The pubofemoral ligament connects the superior pubic ramus and anterior inferior rim of the acetabulum to the femur at the inferior trochanteric line. This ligament limits hip extension and hip abduction. The ischiofemoral ligament is located on the posterior side of the hip joint. It connects the ischium and posterior inferior rim of the acetabulum to the medial aspect of the apex of the greater trochanter. The ischiofemoral ligament limits hip extension and internal rotation, as well as adduction from the superior fibers and flexion from the inferior fibers. On this anterior view of the hip joint, draw in the iliofemoral ligament and the pubofemoral ligament. How does your drawing compare? In pink is the iliofemoral ligament In blue is the pubofemoral ligament. Notice you can see a slight amount of purple representing the ischiofemoral ligament where it attaches to the apex of the greater trochanter. From this posterior view, finish drawing in the ischiofemoral ligament. How does your drawing compare? Note that in pink, you can see a portion on the posterior side of the iliofemoral ligament. Study this slide of the three primary ligaments of the hip joint. Try to picture movement of the hip joint and which ligaments would be taut during each movement, which would then in turn limit that particular movement. The ligamentum teres, also known as the ligament of the head of the femur, connects the femoral head to the acetabulum. It is associated with the acetabular labrum and contains an artery to the head of the femur. The artery is very important for development in the fetus and the infant. The importance of the ligamentum teres decreases with age, where blood vessels begin to form within the femoral neck. The ligamentum teres tends to degenerate somewhat with age. Study this slide for the anatomy of the ligamentum teres. The thigh is covered by connective tissue called the fascia lata. The fascia lata gives off septa, dividing the thigh into three compartments. These compartments each contain muscles that are innervated by the same nerve composing the motor map of the thigh. The anterior compartment contains muscles innervated by the femoral nerve. The medial compartment contains muscles innervated by the obturator nerve. And the posterior compartment contains muscles innervated by the tibial nerve. In your lecture notes, draw in a cross-section of the thigh with the posterior, medial, and anterior compartments and their contributing nerves. The tibial nerve to the posterior compartment, the obturator nerve to the medial compartment, and the femoral nerve to the anterior compartment.